When patients think about a breast implant, they usually think about what's inside it, the silicone gel or saline. But I'm equally interested in what's on the outside. The shell is the only part of the implant that actually touches your body, so how that surface interacts with your tissues is incredibly important. Over the years, there have been smooth, which is these, and variation of textured implants, which are these. Some were coarsely textured and some less so. The idea was to get the tissue to adhere to the implant to reduce movement and hopefully decrease problems like capsular contracture. It was a logical idea, but eventually we discovered an association between coarsely textured surfaces and a rare lymphoma called BIA-ALCL. That dramatically changed our thinking, and today we've moved predominantly towards these smoother surfaces. But here's where things get very interesting. We're beginning to think about the implant interface simply not as a mechanical interface, but as a biological one. Whenever we put an implant, and that's anything from a breast implant to a hip joint, into the body, your body forms a thin layer of scar tissue around it called a capsule. That is completely and 100% normal. The question is, can we engineer the implant surface so your body responds to it with less information and less aggressive scar formation? That's one reason I find some of the new interface technologies, including Motiva's smooth silk surface, so interesting. The goal is to create a more harmonious interaction between the implant and your tissues. Motiva's implants have meaningfully changed the landscape when it comes to capsular contraction. The best way to treat a capsule is to prevent its inception. And I think that's where the future of breast implant technology is headed, not simply building a better implant, but building an implant that your body can welcome.